Welcome to Angel Health Academy. Topic for the day or topic for the session is Health-Illness Continuum. The Health-Illness Continuum is a model or it is a conceptual framework. So it is a model which explains the theory of health and illness, or it is a conceptual framework that illustrates, that shows the dynamic and fluid nature of the health. The dynamic and fluid nature of the health. The dynamic and fluid nature means the changing nature of the health. Health may become maximum health or optimum health or wellness, or it can even go in the opposite side like illness and death. Okay, that is the dynamic and fluid nature of the health. Thus, it represents health as a spectrum. Okay, health as a spectrum that is ranging from optimum wellness to one end and to severe illness or death in other end. So health is considered as a spectrum. In that spectrum, one end is the maximum health, optimum health, okay, that is wellness, and the opposite side of the spectrum or another side of the spectrum, there is a severe illness or death, okay, that is the dynamic and fluid nature of the health. So, health-illness continuum represents as a spectrum, or it is a model, or it is a conceptual framework. It explains that the idea behind this, that an individual health status is not static, okay, it is not stable, okay, it is not permanent, that will be moving from one side to other side. That means, but moves back and forth. It moves backward to illness and forward, that is forth, along with the continuum for optimum or maximum health. The idea is that an individual health status is not static, okay, but moves back and forth along this particular health-illness continuum, depending on various factors. Whether a person is having or becoming or suffering illness or having maximum health or optimum health or wellness, that depends upon number of factors such as lifestyle choices or lifestyle practices or behavior of the person, medical care acceptance of the person's, genetics background, okay, of the particular person and his family, then environmental influence or environmental factors, and mental and emotional well-being or health of the persons. So these are all the factors which influence the spectrum of health or the health-illness continues to become wellness and to go for illness or severe illness, disability or even death. Now let us see the model of health-illness continuum. Okay, this is the conceptual framework you have to draw and you have to explain when you ask the question about the health-illness continuum. Okay, first I will tell you how to draw this health-illness continuum, then we will explain one by one. So first you have to draw a parallel line like this, okay, with the two directions. So this is a parallel line with the two direction. Then in the left side you have to write it is wellness, and in the right side you have to write it is illness. Okay, for this parallel line, the left side is wellness and the opposite side of this spectrum or line is illness. Okay, like that you have to write it. Then you have to cross this parallel line. Okay, so like this you have to cross this, that is the neutral point, that is called health. Okay. So first you have to make a parallel line, then you have to cross. Okay, now you got two sides of the spectrum. Okay. Next you have to draw a parallel line like this towards the wellness. Okay, then you have to write increasing health. So moving from the center health towards the left side, that indicates the increasing health of the persons to maximum optimum health or wellness. Okay, then opposite side also you have to draw one line like this, then there you have to write that is increasing illness. If the person move from this central point, neutral point towards the right, that increase the illness. Okay, so you can see we have already mentioned the illness. Okay, then we have to talk about the left side of the health-illness continuum. What about the wellness? How a person get the wellness? What are the factors influence? So in the left side towards the wellness, person should have a good health, then that may lead to optimum health. So like that you have to write. Then how a person can become a good health or optimum health is, that is through getting awareness, education and ultimate growth of the person. So here you can remember a short form, that is age, but that is not writing in the same way, but the A stands for awareness, G stands for the maximum achievement, that is the growth of the persons. Okay, then that is done through education. Okay, so awareness, education, growth, that all comes under in the increasing health, and that may lead to final optimum health or wellness of the person. Okay, Now opposite side person may go for illness. Okay, there you have tried to poor health that may lead to diseases, and sometimes the disease may become severe and it may cause disability or even death. Okay, so that you have to mention like that is signs, symptoms, disability and death. Okay, so person may feel if it is poor health, various signs and symptoms of the diseases that may lead to disability, and sometimes he may go for the death. That is the right end of the health illness continuum. Okay, so these are the contents included in the health illness continuum. Then we can give the outer line for this health illness continuum. Okay, so now you can draw like an outer line like this. After the outline, now your model is ready. The conceptual framework is ready like a health illness continuum. Okay, so now you know that the health illness continuum has a two sides. Okay, that is right side and left side. Right side is it is moving towards the wellness. Okay, that is starting from good health and maximum health or optimum health. Okay, then opposite side at the same time where person may go for the illness. Okay, that is starting from poor health, disease, that the factors like or indicate signs, symptoms, then maybe disability or at the last even death. That is the increasing illness of the person, that is towards the right side. So now let us talk about the key points or elements of the health illness continuum. Okay, as you know, it includes one side wellness and another side illness, and the center point is the neutral point, that is the general health. Okay, then you have to explain two more points, that is movement along the continuum, that is towards the right and towards the left side. Then how a person maintain holistic approach to move to the wellness of the health illness continuum. Okay, so these are the key points or elements of health illness continuum, that is wellness, illness, neutral point, movement along the continuum and holistic approach. Let us explain one by one these key points or elements. First one is wellness. So in one extreme of the health illness continuum is the optimum wellness. Okay, that includes, we already studied optimum wellness or optimum health includes physical, mental and social well-being. All these three dimensions, that is physical, mental and social well-being, you may have optimum health or optimum wellness. Okay, that means a person at this end, that is in the optimum wellness end, maintains a healthy lifestyle or healthy practices. That means he engages in the all preventive health services. He take all preventive measures like vaccinations and other awareness. Okay, and enjoy his emotional stability. So he may have a normal emotional health and mental health, and he may have a good relationship with the society and group, that is a social health, and fulfilling sound relationship. So wellness means in the one extreme of the left side of the continuum is the optimum wellness, that includes physical, mental and social well-being of a person. Okay, that is maintained by a person by following healthy lifestyle and engaging preventive health measures and services, and enjoying or having emotional stability or mental stability and mental health and social relationship, that is fulfilling sound relationships. Then second key point of the health illness continuum is illness. The other extreme represent a state of illness. You have already seen that, which could involve either chronic diseases or acute medical condition or diseases, or it may be a decline in the mental and emotional health of the person, that also lead to mental illness and emotional related problems, stress related problems. Okay, this could also extend, that means the illness can make a disability to the person, or illness can even cause death for the person at the maximum end. That is moving towards the right side, that may lead to illness or diseases, that may lead to disability or even death. Then third point is neutral point. Okay, in the middle of the continuum is a neutral point where an individual is neither ill or nor experiencing optimum health or optimum wellness. That means this is sometimes referred as a normal health. That is the normal health of the person. There no apparent illness exists, but wellness also is not maximized. Thus, in the neutral point, a person is in risk with having various illnesses that may lead to disability and even death. Okay, at the same time, if you follow certain healthy practices, he can achieve the optimum health or maximum health. The fourth key point is or element is movement along the continuum. Movement along the continuum. The position on the continuum can shift over time. So a person position in the health illness continuum is not stable. He can shift either in the wellness towards the left side, or he can shift even in the right side towards illness. So the position of the person on the continuum can shift over time towards wellness and towards illness. For example, engaging in physical activity, healthy eating and stress management all can move a person, someone towards the wellness or optimum health. While neglecting the health or healthy practices, that can lead towards the illness side, that is in the right side of the health illness continuum. That is the movement along the continuum that is not stable. It can shift at any time, okay, according to the healthy practices and healthy behavioral and lifestyle of the person, or exposure to various infectious agents, other morbidity conditions, etc. Then fifth key point is holistic approach. So this health illness continuum actually it reflects a holistic approach, okay, towards the health by considering the interaction of physical, mental, emotional and social factors. So there are many factors which influence our health. Interaction of that factors will lead to a holistic health, okay. So continuum reflects a holistic approach to health by considering the interaction of physical, mental, emotional and social factors. Thus this health illness continuum acknowledges, okay, it reveals that health is not merely the absence of disease. Health means, or it involves overall well-being of a person, that includes physical, mental, emotional and social well-being. That is the holistic concept of the health illness continuum, okay. It reflects a holistic approach of health, that is, it is not merely an absence of disease or infirmity, but it involves overall well-being with the physical, mental and social well-being, that is positive or optimum or maximum health. Thus this model, health illness continuum model, emphasizes the importance of self-awareness of the persons, okay, self-awareness of the individual about his health and health condition, and proactive healthy behaviors or healthy practices of the person, that is proactive individual or person healthy behaviors and healthy practices that shift towards the wellness side of the continuum, that is towards the left side of the continuum, thus improving the quality of life and standard of life and preventing a number of diseases in the life. Okay, this is about the health illness continuum model or a conceptual framework. So today we have discussed an important concept in the health and community health nursing, that is health illness continuum. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next an important academic video. Okay, please don't forget to subscribe my channel and mention your gratitude in the comment box. Then once again, thank you so much for watching my video.